On April 23rd, the 139th Pennsylvania Legislative District will host a special election to fill the vacant seat left by State Representative Joseph Adams, who resigned in early February. One of the candidates on the Democratic line is Robin Schooley Skibber, the former director of the Pike County Area Agency on Aging. Welcome to the program, Robin.
Oh, thank you very much, Patricio. Thanks for having me.
You were the former director for Pike County Area Agency on Aging. Can you describe a specific experience from your time there shaped your approach to public service?
Okay, that's a good question. Working with the area agency on aging, you were under the policies of the Department of Aging, and which is under the ACL federally. We come the old. We stem from the Older Americans Act from 1965 that we need to have services and programs for the most vulnerable older adults. It started with the nutrition program, grew from that into home care, home and supports in their communities to keep older people at home where they wanted to be. And from that, we are now in Pennsylvania. We're under the jurisdiction of in our case in Pike County was the county commissioners. There are some nonprofit area agencies on aging that have a governing board, but we were what we call public, and the commissioners were our bosses, so to speak. They were responsible for hiring and firing, promotions, and things like that. So working in that system where you're state funded and you're abiding by what the local decisions are and serving local people, it became, I wouldn't say a balancing act, but a approach to know where the money's coming from, where it needed to go, and then justify it to the local powers to show that we were doing our due diligence and being good stewards of the state dollar, but also trying to provide as many services as were needed. In any type of human services environment, whether it be children and youth or aging, some of the other programs, you're usually outpaced by the demand than what your funds and program dollars can cover. So you're forced to work with the the absolute most in need. And then we have programs that are mandated with the protective services, which is a 24-hour, 7-day a week crisis line, for lack of a better word, to serve emergencies that happen with older adults with neglect, abuse, exploitation. So it sets up that you're doing as much as you can with a limited budget for the most people you can. So you want to get the biggest bang for your buck and serve the people in their own communities. So I think doing that for the 20 plus years I did taught me a lot about advocating, working with your state legislators, working with the commissioners and explaining where the needs were. And the needs change with the growing population. There were, and in the advent of a lot of the overdosing drugs, older adults became the caregivers for the young people and their family almost instantaneously, which is very difficult, as you could imagine, if you were 70 or 80 years old and now you're responsible for a teenager or something like that. So our programs had to change with the times, and we did advocate for more dollars. In Pennsylvania, we're very fortunate to have the lottery as our biggest funding source, and it is one of the only states that does that. So we're very fortunate, but that did not cover all of the needs. And we had waiting lists. We instituted cost share programs for the people that could pay some to stretch the service dollars to cover more people. So I think in that, it set up my understanding of how to work through the governmental process. Through legislation, we advocated for certain bills, certain protections for the funding dollars, advocating for a fair funding formula through the different counties. Over the years, some counties lost older adult populations, some gained. And we, as a border state too, both New York and New Jersey, we gained quite quite a lot of new residents, especially since 1,000 and again after the pandemic.
Right. Now, this is your first time trying to hold a public office. Why did you decide to run?
Okay, so I was appointed as the area agency on aging. I was not a candidate, or I did not have to campaign. It is an appointed position. So this is the first time I've entered into a campaign for public office. And I think it was the what we say in our slogans is right time, right choice. For me, it worked out because I had just left my position and I had some time to do some fun things and travel and gain some more farm animals and things like that. But my work and my serving the greater community never leaves you. So when the opportunity to continue working in my community and into Wayne County, which is fairly similar to Pike, and have a broader stroke and keep learning. I learn things every single day, and I wanted to take that chance and be the person that continues to serve older adults, people with disabilities, their families, young people. I grew up here. My kids were raised here. I know the challenges, and I think I can fight for some of the programs and services that I think we need.
And you talked about a little bit before when I first asked you about your approach to public service, and so you envision that your experience with the agency on aging can translate to the broader demographic of your area, and it could influence the way you handle public policy. Is that correct? Or
Yes, I think you learn a lot when there's certain legislation that comes through when we had the Protective Services Act change and you have to navigate. Does it affect the staff? Does it affect response time? Do things happen in the Commonwealth, especially, and they happen in other states as well. When a bill gets passed, it can affect obviously, there's usually an appropriation piece or a budget piece to it, but also the laws affecting it and, like, the law enforcement act of the protective services, so it touches on different pieces, so it's not if you just need money for this project and you ask for it, that's different, that's like a grant, but for things that have sweeping effects to make sure that the laws change going forward, I think it's important to understand that process, and it doesn't happen quickly. And maybe that's one of the biggest things people learn working in the government entity. It takes time.
now let's talk about some of the issues that the 139th is facing. Given the ongoing issues such as fentanyl crisis and mental health inadequacies, what are your your first steps that you would take to address these in the legislature?
That's a good question. And the fentanyl crisis it's very traumatic and it affects every aspect of the community from law enforcement, families, hospitalizations, mental health, and substance abuse treatments. So it has a lot of effect, and having a collaborative environment to maybe put more effort on the front end with education and prevention can always save more lives and dollars. And I don't want to equate it like that, but it's true. It's in chronic diseases, but especially with mental health and substance abuse, the more you prevent, the more crisis you're going to run into. The problem that we face, like many other areas, is the lack of program dollars for the prevention and the lack of therapy and counseling providers that are out there. There has been a great um, win with the telehealth, but there's certain things that have to happen with telehealth, and that's more, of course, on the mental health side. But there is counseling groups and support groups for NAMI, mental health support groups, and substance abuse support groups. So I believe there's stuff that's online, which is great. It's just getting the people connected in Sullivan and in Wayne and Pike County. Sometimes internet and access to those programs is not.
I talked to someone else about this particular issue about connectivity, and the one of the things that came out of the pandemic was a lot of things went online, and like therapy really boomed online, and you were able to have therapy online, have access to that. But if you're living in those areas that don't have connectivity. You're out of luck with that, and also just transportation issues. You could maybe see your therapist, but you have to drive 40 minutes away if you have a car. If you don't have a car, it's tough with public transportation. I believe where you are, there is some kind of public transportation. And
Yes, in Pike and Wayne and throughout the counties in Pennsylvania, they have PennDOT has a shared ride program. So it does serve seniors 65 and older and has a greatly reduced per person fare. And it is a shared ride so they can access their shopping, their banking, their medical appointments, senior center socialization. It is limited because of the nature of our areas and the fact that we don't have a specific health system. Many of the vans are out of the county a lot of the day going to Wayne County and over to New York, Newton, Wilkes-Barre. So that has its own challenges to be available for the people in the county to go to things when the vans are they prioritize medical and dialysis appointments. And the wonderful thing is it does do free transportation for people on medical assistance. So that's a great benefit. And then also it has a reduced fare for people with disabilities can also ride. So you do not have to be a senior to access it. But again, it is very limited because of the nature of our area. And that would be something I would like to help in any way as a state legislator, work on some pilot programs or extended hour programs for services.
right. Just I want to stay on the topic of healthcare here. One of the things you said, you are committed to protecting access to women's healthcare, including abortion, is one of your sort of highest priorities. The
Mm.
opponents that are running in the special election, the two Republicans running in the primary, are you say are both are anti-choice. So let's talk about that. About how do you like to protect access to women's healthcare? Because that's also a national thing. That's what's on really happening. Really, one of the big topics that's coming up here for November. So
Yes.
your capacity, what how would you help protect the access to women's healthcare?
Again, the access to the services, if you go on Planned Parenthood, which I'm an endorsed candidate by, there's no local areas that provide Planned Parenthood services. You have to go down to Lehigh County or maybe Luzerne County or over to New Jersey for the basic services that they provide contraceptive health, some mental health counseling, STDs testing, and things like that, as well as clinic services. For right off the bat, there's just not the amount of providers that are doing the service, and to have laws in other states that are actually shutting down total access is we're going backwards. Roe versus Wade happened for a reason, and there's states that are wanna go back to pre-Roe versus Wade. A woman's ability to provide her own health care and her provider to make that decision should be private between them, whether it be termination, whether it be sex education, like whatever it is, it shouldn't be garnered by a legislator who doesn't believe it's a correct thing to do.
So like I said, we have April 23rd is the special election, and also a primary for the Republicans there. Come November, you're gonna face either one of them, or basically or hold the seat up until November and then have a runoff with them. Why should folks vote for you over any of your other opponents?
I've worked with Republican legislators as well as Democratic commissioners and legislators, and everyone's working together. You have to. You can't be polarizing. And I've said this before. I think we all meet in the middle more than most people think. And I've talked to so many of my friends and constituents that think having me in the house is going to be a benefit because they've seen what I've been doing. And people want very similar things for their families. Their young people want a good education, and they don't want their children to have to move to other states to get a good paying job. They love this area. They love this whole Northeast Pennsylvania into New York State area because it's beautiful and we provide those benefits, and we're so close to New York City, so we have the best of both worlds. But is it easy? No, it's gonna be a challenge to balance what we wanna protect versus where we need to keep smart growth, better paying jobs, and things like that. We're hoping that we can get an urgent care or some type of an acute care facility in our region because that drives dollars out of the area when people are going to Scranton, they're going to Newton, they're taking their dollars with them, they have to get gas, they have to buy lunch, like, all of that leaves our area because we don't have that network of mini hospitals, whatever it might look like, and or urgent cares. So I think it's very important. And also it'll help our emergency services if they can transport somebody less than 40 miles away, which is what some of their trips are right now.
It's amazing to think about that, not having urgent care nearby. Anyway, Robin, thank you so much for talking to me. We're talking to the Democrat candidate, Robin Schooley Skibber, who is running in the special election on April 23rd. Also running for the general election in November. Thank you so much for talking to us, letting us know about the issues and what your thoughts on the issues. And good luck this Tuesday.
Thank you very much, Patricia. It's been my pleasure.